is an associate professor and senior lecturer in the School of Community and Human Development, the Department of Psychology at the University of the Witwatersrand. He's also an associate researcher at the Center for the Study of Violence and Reconciliation. His research interests include risk-taking behaviors amongst youth and their role in politics, substance abuse and addiction, trauma and collective violence, and the psychology of men or masculinity in post-apartheid South Africa. Malusi has published book chapters and journal articles on violence and other topics related to masculinity. And he is the author of a recent book entitled Becoming Men, Black Masculinities in the South African Township. Over to you, Malusi.
Thanks very much, Steve, for the invitation to be part of this conversation. And thanks very much for all the guests for having me time to be part of this webinar. And obviously, I guess my two colleagues, in their presentation have highlighted, very key points, to say COVID-19 has been a game changer. And it is quite evident, based on the previous presentation, that obviously, the world will not be the same post COVID-19. And I guess psychologists, political scientists, at this point in time, I think all of us are trying to make sense and understand the impact of COVID-19 on almost everything, including children, adults, and people of different ages, gender, and many other differences. So my contribution to this conversation, it is preliminary, based on the work that I'm currently doing with Center for Study of Violence and Reconciliation on a project entitled Youth Inclusion, which looks at how the project on community work can facilitate the inclusion of young people in the economy. But for today, I want to focus on the impact of COVID-19 on the youth, especially young men. Given my research interest on masculinities. First, we all acknowledge that the youth have been occupying a precarious position prior COVID-19, and obviously what this pandemic has done has exacerbated their precarity. Findings of multiple surveys clearly show that COVID-19 has created so much uncertainty, including some of the mental health issues that were raised in the previous presentation. To say from a policy point of view, as we are thinking about youth inclusion, we also need to address mental health issues. Of course, a lot has been written preliminary about the impact of COVID-19 on women. But in this presentation, I want to focus on young men and their responses to COVID-19. So the few points that I wish to sort of address on how the notion of hegemonic like no masculinities may have been negotiated by like no young men in the context of like no COVID like no 19. So the work that I'm doing with Center for Study for Violence and Reconciliation, it is in the so obviously, I mean, some of this like no comments on how the notion of like no hegemonic like no masculinities was like no negotiated is based on like no some of my observations during like no field work, and also the militarized like no policing of like no young men during the lockdown regulations, and the theme on COVID-19 as a life-threatening like illnesses, and how young men have responded to this like pandemic. And then the last point would be young men and healthcare work in relation to like the pandemic. So the first theme around the policing of like young like black men, my work prior COVID-19 has shown that policing of young black men has always been like violent. And obviously here I'm basing this on the analysis that I did, where I took annual reports of like IPID over a period of like few years prior COVID like 19. So when you look at the stats of this like annual like reports, they show that violent like attacks, especially cases of like torture, and in some cases murder, were on the increase. And obviously these are acts perpetrated by law enforcement like officials recorded in the annual reports of like IPID. So many of us who have been doing this work around torture and violent like attacks by the police, we're not shocked to see the scenes of law enforcement like officials harassing people, especially young black men during lockdown. Our argument is that policing of young black men obviously is based on racial stereotypes of seeing young black men as violent and aggressive. So obviously all the cases that were reported, including killings that were recorded during the lockdown, did not come like as a surprise. So obviously the atlas of being poor and living in particular contexts make them to be more vulnerable. And obviously the lockdown regulations made it very easy for them to be targeted by law enforcement like officials. So obviously, I mean, a lot has been written about what we call male-to-male like violence. So obviously, I mean, the policing of like young like black men was like highly militarized during the lockdown. COVID-19 as a life like threatening illnesses, which a lot of studies show that it had created like so much like anxiety. But we all know that the risk-taking behavior is a key feature of what it means to be like a male like person. So obviously some of these like comments must be read in context, where I observed when I was doing like my field work in Alexandra, that not wearing a mask for some of the young men was seen as a sign of heroic like masculinity. And the issue about sanitation and obviously the practice like around regularly washing like your hands. Obviously, I mean the context of in some communities people may not have like no water, and sanitizers to regularly wash their hands must be taken into account in reading this like no comment. But for some young men, cleanliness practices were in conflict with what it meant, to be like young men in some of the street corners when I met them during like my field work. So obviously there was a lot of like conflict in terms of what it meant to be like a real young man living in a particular like context, and suddenly you're expected to be clean like at all the time. And then the other theme that emerged, during like my field work was the issue about men and health seeking sort of like behavior. And when you look at the stats in terms of the mortality rate, is that many men, given their life like style, are more likely to have underlying health like problems, which then increase their risk of dying from like COVID like 19. Some of the unhealthy like life like styles obviously include like smoking and excessive like drinking and lack of exercise. So obviously in the field work, what emerged was some of this like risk like taking like behaviors amongst like young men. And I think it links with the point that was made in the previous like presentation, where many of them spoke about like feeling bored, and for them to deal with their feelings of boredomness, it entailed, though men were not allowed, given the lockdown regulations, to buy like alcohol. Some unfortunately had like no means of illegally getting sort of like alcohol. And the argument in terms of like explaining their drinking, one can argue to say it was linked with mental health like issues which were indicated in the previous like presentation. And then the other theme, because what we had during like lockdown was about gender-based like violence, and where a lot of like stats were released, to say during lockdown there was like an increase in terms of reported cases of GBV. But what is not being recorded, which preliminary emerged out of like my work in this like township, it's around positive fathering like practices, where some young men, as a result of lockdown regulations, the fact that men were not going to work, those were able to stay at home. And being at home for them, for some, they had to assist in terms of the chores in the household. And for them, upon their reflections, is that it gave them like an opportunity to, inverted commas, be sort of like good like fathers, and support also their children for those that were doing online like classes. And then the other issue was about where, for those who were part of the community work like program, which is a program that I'm investigating, where, because during lockdown they were not able to do their normal community work like activities, and they took upon themselves to then raise awareness about COVID 19 in their respective wards where they were staying in Alexandra township. And the last 2 points, it is about this for those that were working in the informal sector, that prior COVID-19 they were providing car wash services. But because of lockdown, they were not able to get customers. And some developed app services where people could log in and call them to come and wash their cars in their house, households. And even those that used to cook on the street corners, they then created app services where people log in and order food sort of online. But the main challenge was the issue of data, where some were not able to have data at all the time. So obviously my two concluding remarks in terms of my observation is that post lockdown, what I observed is that in each and every corner, there was a massive increase in terms of informal economic activities. So obviously the key question that I have as I'm doing my research is about the sustainability of some of these economic activities. And then the other question was about the 350 unemployment grant, where we busy doing informally, as one is doing field work in terms of youth inclusive activities in relation to community work program. Along the way, some of the community members are talking about the impact of the 350 rand grant. So obviously, as part of this conversation, because there's still going to be another conversation which Steve will be organizing, it's where then I will share some of the key findings of CWP and some of this in initiatives. And I'll want to pause here. Thanks, Steve.